Medications, while essential for treating various health conditions, can have a range of side effects on the skin. These effects can manifest in several ways, from mild dryness and sensitivity to more severe reactions like photosensitivity, rashes, and even permanent damage. While many people rely on prescription or over-the-counter drugs to manage chronic conditions, the impact that these medications can have on the skin is often overlooked. Understanding how certain drugs affect skin health can help individuals manage these side effects effectively, while also taking proactive steps to minimize skin damage. One of the most common skin-related side effects of medications is dryness. Certain drugs, especially those used to treat conditions like high blood pressure, acne, or depression, could dehydrate the skin, leaving it feeling tight, flaky, and rough. For instance, retinoids, commonly prescribed for acne treatment, work by accelerating cell turnover to promote clearer skin. However, this process can also lead to skin dryness and irritation, as it disrupts the skin's natural barrier. Similarly, diuretics, often prescribed for hypertension, can increase urination and cause dehydration, leading to dry, parched skin that can be difficult to soothe. This dryness can be particularly problematic for individuals with pre-existing skin conditions, such as eczema or psoriasis, where the skin is already prone to irritation. When the skin is excessively dry, it becomes more susceptible to cracking, inflammation, and infections. The loss of moisture also compromises the skin's protective barrier, which can lead to further sensitivity and irritation. For people taking medications known to cause dryness, using hydrating skincare products like emollients or moisturizers can help to alleviate the discomfort. Drinking plenty of water throughout the day is also crucial for maintaining hydration levels and supporting skin health. Another common side effect of certain medications is increased sensitivity, making the skin more prone to irritation, redness, and reactions to environmental stressors. Medications such as oral antibiotics, antifungals, and some chemotherapy drugs can make the skin more sensitive, leading to irritation from otherwise harmless substances. For example, antibiotics like tetracycline, often prescribed to treat bacterial infections, can cause the skin to become more reactive, making it more prone to sunburns and rashes. Topical medications, such as steroids, can also thin the skin, making it more vulnerable to damage from friction, harsh weather, and minor cuts or scrapes. Individuals taking medications that cause increased skin sensitivity should be cautious when using skincare products, as harsh ingredients such as alcohol, fragrances, or exfoliants can exacerbate irritation. Opting for gentle, hypoallergenic formulations is key to avoiding additional sensitivity. It's also important to protect the skin from physical damage by being mindful of sun exposure, minimizing friction from tight clothing or rough fabrics, and using mild cleansers. Perhaps one of the most concerning skin side effects of certain medications is photosensitivity, which makes the skin more vulnerable to damage from UV rays. Some medications, including certain antibiotics such as doxycycline and tetracycline, diuretics, nonsteroidal anti-inflammatory drugs, NSAIDs, and chemotherapy drugs, can increase the skin's sensitivity to sunlight. This heightened sensitivity can cause severe sunburns, even with minimal exposure to the sun. Photosensitivity can also accelerate the aging process by causing premature wrinkles, pigmentation changes, and an increased risk of skin cancer. For individuals taking photosensitive medications, it's crucial to take proactive steps to protect the skin from UV radiation. Applying a broad-spectrum sunscreen with a high SPF, wearing protective clothing such as hats and sunglasses, and avoiding direct sunlight, particularly during peak hours, 10 a.m. to 4 p.m., can significantly reduce the risk of sun damage. In addition to these protective measures, individuals should also consider using physical sunscreens containing mineral ingredients like zinc oxide or titanium dioxide, as these provide a more effective barrier against UV rays for photosensitive skin. In some cases, medications that cause photosensitivity can also lead to long-term skin issues. Prolonged sun exposure while taking photosensitive drugs can lead to the development of sunspots, freckles, and uneven pigmentation, which can be difficult to treat once they have appeared. These pigmentation changes occur because the skin becomes more prone to melanin production in response to UV radiation. For people who already have existing skin concerns, such as melasma or age spots, this effect can be particularly troublesome. In addition to dryness, sensitivity, and photosensitivity, some medications can cause more serious allergic reactions that affect the skin. For example, medications like penicillin, sulfa drugs, and certain anticonvulsants can cause rashes, hives, or even more severe reactions like Stevens-Johnson syndrome, which results in widespread skin peeling and blistering. Although these reactions are rare, they can be life-threatening and require immediate medical attention. It's important to always monitor the skin for any signs of unusual reactions when starting a new medication and seek medical advice if any symptoms occur. To manage the skin side effects of medications, individuals should follow several key steps. First, they should consult with their healthcare provider about any potential skin reactions before starting a new medication. Some medications may have alternatives that cause fewer side effects, or dosage adjustments may be possible to minimize skin irritation. Additionally, keeping a detailed record of any changes in the skin while on a new medication can help identify any patterns and determine whether the medication is the cause of the skin issue. For those experiencing dryness, sensitivity, or photosensitivity, using a comprehensive skincare regimen is essential. A gentle skincare routine that focuses on hydration and protection can help alleviate many of the discomforts associated with medication side effects. Using a mild, fragrance-free cleanser, a rich moisturizer, and a sunscreen specifically designed for sensitive skin can go a long way in preventing further irritation and protecting the skin from environmental stressors. In cases where the skin reactions become more severe, or when an allergic reaction is suspected, it's crucial to stop the medication and seek medical attention. A healthcare provider may recommend an alternative treatment or prescribe topical or oral medications to address the skin issues caused by the initial drug. In conclusion, while medications are vital for managing various health conditions, they can have unintended side effects on the skin, ranging from dryness and sensitivity to photosensitivity and severe allergic reactions. Understanding the potential skin-related consequences of the medications you're taking is essential for managing these side effects and taking appropriate steps to protect your skin. By consulting with your healthcare provider, adjusting your skincare routine, and following precautions like sun protection, you can reduce the risk of skin damage and maintain a healthy, balanced complexion.